This video is for general information only and is not medical advice. Always speak to your GP or healthcare professional for personalised guidance about your own health. What might this investigational weight loss injection mean for women, and what does the early evidence actually show? If you've heard about Retatrutide and wondered whether it could be relevant to you, you're not alone. It's been generating a lot of interest lately, so let's look at what we currently know. Retatrutide is still an investigational medicine. It hasn't been approved for use in the UK yet, and it cannot legally be prescribed here outside of a regulated clinical trial. But research is progressing, and it's worth understanding where things stand. So, what makes Retatrutide different from medicines like semaglutide or tirzepatide? It comes down to how it works. Retatrutide is what's called a triple receptor agonist. It activates 3 hormone receptors simultaneously: GLP-1, GIP, and glucagon. Most currently licensed weight management medicines in the UK only target 1 or 2 of these. The GLP-1 receptor is thought to help reduce appetite and improve insulin secretion. The GIP receptor may enhance those metabolic effects further. And the glucagon receptor is believed to increase energy expenditure and support fat breakdown in the liver. That combination is genuinely novel, though it's not yet known whether this translates into greater effectiveness or tolerability than currently licensed options. Researchers are still working to understand exactly how each pathway contributes in practice. Now, why is there particular interest in Retatrutide for women? Women with polycystic ovary syndrome, PCOS, often experience insulin resistance and metabolic challenges that are difficult to manage. Postmenopausal women can also see significant shifts in metabolic health. Because Retatrutide targets multiple metabolic pathways, there's theoretical interest in whether it could be especially relevant for these groups. However, and this is important, no sex-specific or condition-specific trials have been published yet. The interest is based on the mechanism and early data, not on dedicated studies in women with PCOS or those going through menopause. So we need to be careful not to get ahead of the evidence. What does the phase 2 trial data actually show? Participants saw meaningful reductions in body weight, along with improvements in markers like HbA1c, triglycerides, and waist circumference. These are genuinely encouraging early results, but phase 2 trials are relatively small and short-term. Phase 3 trials, which are larger and longer, are still ongoing, so we don't yet have the full picture on long-term safety or effectiveness. On safety, the side effects seen in phase 2 trials are consistent with what we already know from the GLP-1 drug class. The most commonly reported were nausea, vomiting, diarrhea, and constipation, typically most noticeable when starting treatment. Because Retatrutide is not yet licensed, there is no approved prescribing guidance in the UK. Please don't seek out unlicensed versions of this medicine. Without proper medical oversight, the risks are simply unknown. If you experience severe or persistent symptoms on any medicine, contact your GP or NHS 111 promptly. If you're interested in Retatrutide, here's what's worth discussing with your doctor. Ask about the current status of clinical trials and whether any are recruiting in the UK. Talk through your own metabolic health history, including any conditions like PCOS or type 2 diabetes, so your doctor can help you understand which licensed options might be appropriate for you right now. And if you're of childbearing potential, this is a really important conversation to have. Women in this category should discuss contraception and pregnancy planning with their GP before starting any medicine in this drug class. That applies to Retatrutide and to currently licensed GLP-1 based therapies alike. So, to recap, Retatrutide is a triple receptor agonist with a novel mechanism that early data suggests may support weight management and metabolic health. It is not licensed in the UK and cannot be prescribed here outside of clinical trials. Women with PCOS or postmenopausal metabolic changes may have particular reason to follow this research, but dedicated studies in these groups haven't been published yet. Any decisions about your health should always be made with your doctor, not based on what's trending online. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you want more evidence-based health content like this, make sure you subscribe to the Bolt Pharmacy channel.